Dr. Ryan, what are some of the specific treatments now? You've mentioned it in general terms, but what do people really need to have to do? What do their families have to do to help these young men and women who have PTSD?
Well, I think the first thing to realize and to help our returning soldiers realize is there's not a stigma. In fact, Marines particularly have a credo that says they'll leave no one behind. And I think it's important to consider that if we don't help these individuals, we're really leaving them behind. So to let them know that they were brave when they were in theater, and it takes a lot of bravery to face this fear. Maybe in some ways more, to go back and reface the fear and the trauma. But they can be helped. Another thing for families to consider is that this has an effect on everyone in the family. So it affects marriages, it affects the emotional well-being of wives and husbands, and certainly has a tremendous impact on children. And all family members should feel free to ask for help and get the help they need. We now have a number of different kinds of therapies which we are in the middle of proving are very effective in helping with PTSD. Most of them involve slowly taking the individual back and helping them re-experience the traumatic effects and events while they're in a state of relaxation or their bodies are more settled. And basically we're helping them to learn to be more relaxed and comfortable as they think about and re-experience these events. I guess you could think about it in a very crude way as reprogramming a very basic software in their brain so that they can feel more comfortable and at ease. Another treatment which has been less researched, but the veterans I think for years have been using, is the use of groups. A chance to go back with people who've had similar experiences and talk about and help each other. So I'm very enthusiastic about the use of group psychotherapy to help veterans.
Well, this leads me to ask then, on June 17th, when you and Carolyn and Jim Hodges, a Vietnam War era veteran, all come together, what do you hope to achieve in that little conference?
Well, the first goal is just to raise awareness, to let people in the community, particularly mental health workers, know that this is a problem that we're going to see a great deal of because of how many veterans were exposed recently in Iraq and Afghanistan, as well as other individuals who, like survivors of Katrina and so forth. These individuals are out there. We need to be aware of the effective treatments, and we also need to destigmatize this. The idea that somehow this suggests cowardice, we need to erase that. It's probably the single most damaging aspect of, particularly for veterans, this whole problem. I think, so we want to destigmatize. The last thing I'd like to do is just encourage the mental health community in the Grand Rapids area to begin talking to each other and thinking about how we as a community can help. I hear a lot of criticism of the Armed Services and the Veterans Administration, and they've certainly had some problems. But I don't hear people taking responsibility, saying this is not only a military problem, this is a community problem. We have to be willing to donate some of our time and our resources to help these individuals because they're coming back and they're part of our community. they've put their lives on the line for us, and I think particularly the mental health community needs to think about how we can support them and try to help them make an easier transition into civilian life.
And because we are being stalked by a garbage truck, when I asked you earlier to define PTSD, perhaps we could go through that definition one more time. You said something fascinating, 17 different symptoms, something to that effect.
Exactly. PTSD is a problem that occurs when an individual has been exposed to a life-threatening event. And there are 17 different symptoms, but they basically fall into three different categories. The first is a hyper awareness, or a hyper being hyper alert, which includes being irritable, losing your temper easily, scanning the environment, having a heightened startle response. The second group of symptoms have to do with avoidance. And the individual will often avoid other people, become more isolated, detach himself or herself from their friends and family. And then the final one, and probably the most important symptom, has to do with re-experiencing the traumatic event. The individual may have intrusive memories, they may re-experience sections of the traumatic event, they can have nightmares, insomnia, and it's like they're reliving what has happened to them.
What else would you like to talk about with regard to post-traumatic stress syndrome that we've not covered thus far?
You know, I think we've done a pretty good job of covering things. I mean, of course, it's a very complex area, but I think we've covered the main aspects.
Very good. Well, go ahead.
I'd just like to thank you for the opportunity of speaking to you today.
Well, thanks a lot, Michael. It's been great to have you on a beautiful spring day in the convertible as a Rhodes Scholar at the Hallenstein Center. We appreciate your good work. We look forward to June 17th and seeing what you and Carolyn and also Jim Hodges have to tell us and teach us. I know we're going to get a lot out of that. Thank you so much.